Hello, my name is Dr. Susan Marra. This is Juju, and this is Dr. Marra's Medical Minutes. And today we're going to talk about mycotoxin testing. So everyone asks me about which test do I like to use. And the lab that I like to use is in Florida. It's called Mymycolab. And the reason I like it is because it's a blood test and it tests for the 12 different mycotoxins, not molds, okay? The mycotoxins are what are toxic, not the molds. So it's really helpful. And they give you the antibodies, both IgG and IgE. So you can tell if you have a allergy to a mycotoxin. So that's very helpful. So I think that's the best test. I do not think that these urine tests are useful at all. The Real Times lab and the Mosaic lab, I do not think they are accurate at all. You basically can't reproduce them. And if you can't reproduce a lab, that probably means that the values aren't real. So that's why I do my Mymycolab, which is reproducible, and I've had great results. I've used it for probably 5 years, and I really like it. So what we do is we pre-treat for 14 days with glutathione, NAC, vitamin C, and then something like Toxex or Toxex, something to help you drain. And we do that for 14 days before the mold test. And then you go get the mold test, and then it takes about 3 weeks to get the test results back. And then based on that, then we start to treat. But typically we use mycotoxin drainers like Mycoregan and ProMyco, and we use toxin binders like Ultra Binder and GI Detox that has chlorella, bentonite clay, charcoal, zeolite, things like that. And then sometimes we have to use drugs like cholestyramine or Welchol because those are very strong toxin binders. And most of my patients are on some form of antifungal like itraconazole, and you can take oregano as well. But generally, molds are better treated with medications. I mean, you can use some herbs, but they're not really that good at getting rid of them. The most important thing that you need to do is get yourself out of the moldy environment. So you have to determine where the mold is coming from, and then you have to get out. You have to minimize the exposure to the mycotoxins. Then you pre-treat for 14 days with glutathione, NAC, vitamin C, and Toxex or Cytodetox. And then you do the test. You get the test results back in 3 weeks. And then you can figure out a treatment plan that best suits you. But you are not going to get well if you do not exit the moldy environment. So I hope this information has helped you and that you stay away from mold and that you think about Mymycolab to test for mycotoxins. I hope you have a wonderful day. So does Juju. And we'll see you again soon. Bye-bye.